Hello everyone, continuing with our lecture on inflammation, and we have talked about the events of acute inflammation, wherein we saw that there are some vascular events like vasodilation and increased vascular permeability, and then there are some cellular events. Now talking about these cellular events, leukocyte recruitment to the site of inflammation. Now, how does it occur? First of all, the leukocytes are in the vascular lumen, and then there are three processes which are occurring. One is margination, it is going to the margin, it is rolling, and then it is adhesion to the endothelium. The three things which are happening inside the vascular lumen: margination, rolling, and adhesion to the endothelium. Then it will migrate across the endothelium and the vessel wall, and then after going to the extravascular space, then they will migrate in the tissue toward the chemotactic stimuli. So these are the three events we are going to see. The first one, in the lumen. In the lumen, the first thing which happens is the margination. Margination mein what happens is the movement of the leukocyte, principally neutrophil, toward the periphery of the blood vessel. As the name suggests, it moves toward the margins. And what are the reasons why does it move toward the margin? Maybe because of increased vascular permeability, vasodilation, or because of selectants. The second thing which happens is the rolling. Rolling means transient adhesion of the leukocyte with the endothelial cells, and this is also mediated by selectants. And the third step is the adhesion. That means firmly it is attached. The leukocyte is firmly attached to the endothelial cells, and this is mediated by the integrins. Integrins will be present on the leukocyte, beta 1, beta 2 integrins, and they will be interacting with the ligands on the endothelium like VCAM1 and ICAM1. Beta 1 integrin will have interaction with the VCAM1, and beta 2 will have interaction with ICAM1. Okay, I can show you this in diagram. So this is the interactions happening. Here you can see the leukocyte. This is the leukocyte, and this is the endothelium. Okay. Now leukocyte here, integrins are present and some glycoproteins are present. Integrins here are in low affinity state. Okay. So now selectants, by binding to the selectants, the first thing which is happening is margination. The second thing which is happening is they are rolling, and rolling is because they are transiently binding to the selectants. Now third thing will be the chemokines which will be released by the inflammation. The chemokines release will activate the integrins. Now the integrins will interact with the integrin ligand present on the endothelium like ICAM1 or VCAM1, and this will be a stable adhesion. Okay. Now coming back to the first three steps we have seen in the lumen, now going to the second step. The second step is leukocyte migration through the endothelium, that is transmigration or diapedesis. This happens mainly in the post-capillary venules, and the important molecule responsible for this is PKM1, that is platelet endothelial cell adhesion molecule, and this is also known as CD31. After traversing the endothelium, the leukocyte pierces the basement membrane. And how does it pierces the basement membrane? By secreting collagenases, and then it enters the extravascular tissue. Here we can see the second step is the PKM1, which is present on both the endothelium as well as the leukocyte. By interaction of these two, it will traverse the endothelial cell, and then by secreting collagenases, it will also disrupt the basement membrane, and then it will enter the extravascular tissue. Okay. The last is the migration in the tissue toward a chemotactic stimuli, that is the chemotaxis. And this is the unidirectional movement of the leukocyte toward the site of the injury, and this is along a chemical gradient. So the chemokines, they will bind to the G protein coupled receptors on the surface of the leukocytes, and they will cause the actin polymerization and hence the movement of the leukocyte toward the site. Now the chemotactic agent, they could be exogenous or could be endogenous. Exogenous like bacterial products, and then endogenous like complement system C5a, arachidonic acid metabolized like leukotriene B4, cytokines like IL-8. The complement cytokines and arachidonic acid metabolite, these could be chemotactic factors. Now we have seen that they migrated toward the now they will migrate toward the chemotactic signal. So this is overall the mechanism of migration of leukocyte. Initially there is margination, and then there is rolling. This is mediated by the selectants. Now with the chemokines, the integrins get activated. Then integrins will bind to the integrin ligands like VCAM1, ICAM1. Then they will migrate through the endothelium using PKM because of PKM1, which is CD31. And then the last step is the chemotaxis. Then they will migrate along the chemical gradient. So this is all.